And then, just as a fact here, for every hour spent driving a car, the likelihood of being obese increases by 6%. So again, obviously I want to focus here on transit. There's definitely a lot benefits to transit. For example, most places when you take the transit, you're not going to get out of the bus and end up at your destination. A lot of the times there's a little bit of walking involved. So the more people can use transit, the more we can invest in transit, the healthier our population will be, and that includes the air quality. Our air quality will be a lot better, so people suffering from asthma and other sort of illnesses like that won't have to be. So,
with the declining birth rate and the aging population, how steep of a challenge do you think it is to get the entire population more active in a manner in which is actually going to decrease healthcare costs?
Well, that's a very, very good question. Right now, what is encouraging for me is that across the country there are already very many organizations that are basically involved in promoting active living from coast to coast, Nova Scotia right down to Vancouver, BC. There are so many organizations out there already that are involved in that. They're trying to get people active, they're trying to get their communities active, and trying to make their cities a lot more friendly in terms of having walkways, having bike paths, having these sort of things. So this is not a new phenomenon, it's happening, people are already doing it, and what we need to do is we have to tie people together now to make sure that everybody sort of cohesively as a country works to promote active living.
You talked about students and people in the workforce and what you do to get them active, but what about seniors? What would you do for them?
That's another excellent question. Right now, obviously, we all know that we have a lot of our seniors who need our healthcare dollars right now. They've done their work in this country for us, and they definitely deserve the healthcare services. I talk about, a lot of times, I talk about the education, the students who are in school, the young kids, as well as people in the workplace, because of the reason behind that is because we have to get those people at this stage. It's sort of like you don't want to wait till they're 65 to take care of them. Yeah, and you want to start taking care of them now, so that by the time they're 65, even if they do need to use the healthcare system, they won't need to use it as much. There are ways for seniors to get active in my platform. I talk about how we can increase safe walkways, odd things that we can also do for seniors.